Let me ask you something important right at the start. If you're over 60 or even over 50, have you noticed that your legs don't feel the way they used to? Maybe they feel heavy when you stand up. Maybe your calves ache at night. Maybe your feet feel cold even when the room is warm. A lot of people brush this off and say, well, that's just aging. But as a surgeon who has spent decades treating older adults, I want you to hear this clearly. Poor leg circulation is not something you should ignore, and it is not something you have to accept. Here's the good news. There is one simple movement I've seen make a real difference for circulation in the legs, even in people well into their 70s and 80s. It doesn't require a gym. It doesn't require long walks. And it doesn't require pushing through pain. But before I show it to you, you need to understand why circulation becomes such a common problem after 60, especially for men. As we age, several things happen at the same time. Blood vessels naturally become a little stiffer. Muscles in the legs, especially the calves, tend to weaken if they're not used regularly. And many men become less active without even realizing it. You may still be busy all day, but if you're sitting more and moving less, the legs pay the price first. The calf muscles are often called the second heart because they help pump blood back up toward the heart. When those muscles aren't working well, blood has a harder time moving upward, especially from the feet and lower legs. This is why so many men over 60 experience swelling around the ankles, cramping at night, numbness, or a tired, heavy feeling in the legs by the end of the day. I've had patients tell me they thought something was seriously wrong, when in reality, their circulation had simply slowed down over time. The body wasn't broken. It just needed the right kind of stimulation. Another challenge I see often is fear. Many men are told to just walk more, but walking isn't always easy or safe. Joint pain, balance issues, or back problems can make walking uncomfortable or even risky. So people stop trying. Then circulation worsens, which leads to more discomfort, and the cycle continues. That's why the exercise I'll share with you is so effective. It works directly with how the body moves blood without stressing the joints. Now, timing matters more than most people realize. Doing the right movement at the wrong time of day can limit its benefits. Circulation tends to be sluggish in the morning after hours of lying still. It can also slow down again in the evening after long periods of sitting. That's why I often recommend doing circulation-focused movements at specific times, especially before long sitting periods or before bed. When done correctly, this can reduce nighttime leg discomfort and help you feel steadier during the day. Lifestyle plays a role too, and this is something I always discuss with my patients. Dehydration thickens the blood, making circulation harder. Sitting for long stretches without moving allows blood to pool in the legs. Even footwear can affect how well your calves engage when you walk or stand. You don't need to change everything at once, but small adjustments make a big difference when combined with the right exercise. I want to be very clear about something. This is not about pushing your body harder. It's about working smarter. One well-chosen movement done consistently and calmly can wake up the muscles that support circulation. I've seen men regain warmth in their feet, reduce swelling, and feel more confident on their legs again, simply by doing this regularly. In the next part, I'll explain exactly what this one exercise is, why it works so well for circulation after 60, and how to do it safely even if you haven't exercised in years. Take a moment, get comfortable, and stay with me, because this could change how your legs feel every single day. Now let's talk about the movement itself, because this is where most people are surprised. When they hear exercise for circulation, they imagine something complicated or tiring. But the exercise I'm talking about is simple, controlled, and very focused. In fact, many of my patients say, "That's it," when I first show them. And yet, when done correctly, it directly activates the exact muscles that help move blood out of the lower legs. This movement centers around the calves. As I mentioned earlier, the calf muscles play a huge role in circulation. Every time they contract and relax, they squeeze the veins in the lower legs and help push blood upward. When this action is missing or weak, blood tends to settle downward. That's when you feel heaviness, pressure, or swelling. So instead of exhausting the entire body, we target the calves in a very intentional way. You can do this exercise standing or sitting. I usually recommend starting seated, especially if balance or joint comfort is a concern. Sit upright in a sturdy chair with your feet flat on the floor, about hip width apart. Make sure you're not slouching, but don't tense up either. Relax your shoulders. Place your hands on your thighs if that feels natural. From this position, slowly lift your heels off the ground while keeping the balls of your feet planted. Think of pressing the floor away with the front of your feet. Lift only as high as feels comfortable. There's no prize for height here. What matters is control. Pause gently at the top for a second, then slowly lower your heels back down until they touch the floor again. That's one repetition. Now here's the part most people miss. The speed matters. If you rush this movement, you lose much of the benefit. The calves respond best to slow, steady contractions. Imagine you're moving through thick air. Lift for about 2 seconds, pause briefly, then lower for about 3 seconds. This slow lowering phase is especially important. It allows the muscle to work in a way that supports blood flow more effectively. At first, you might feel very little. That's normal. Some people feel a gentle warmth. Others notice a light pumping sensation in the lower legs. You should not feel sharp pain. If you do, stop and adjust. Comfort always comes first. Start with 10 repetitions. That's it. After a short rest, you can do another set of 10 if it feels good. Over time, many people work up to 3 sets. But even one set done consistently can make a difference. Consistency always beats intensity, especially after 60. Once you're comfortable seated, you can try the standing version. Stand behind a chair or near a counter so you can hold on lightly for support. Your posture matters here. Stand tall but relaxed. Again, lift the heels slowly, pause and lower with control. Standing adds a bit more challenge because your body weight increases the work of the calves, but it's still very joint friendly. One common question I get is, how often should I do this? My answer is usually simple. Daily is ideal, sometimes even twice a day, depending on your routine. Morning is an excellent time because it helps wake up circulation after a long night. Another good time is late afternoon or early evening, especially if you've been sitting for long periods. Doing this before bed can also help reduce that restless, uncomfortable feeling many people experience at night. Now let's talk about breathing, because this matters more than people think. Don't hold your breath. Breathe naturally. Inhale as you lift, exhale as you lower, or just breathe comfortably without overthinking it. Holding your breath increases pressure in the body and can actually interfere with smooth circulation. I also want to address expectations. This is not an instant fix. Some people notice changes within a few days, such as warmer feet or less stiffness. For others, it takes a couple of weeks. That's normal. Circulation improves gradually as the muscles relearn their job. The key is patience and routine. Another thing I emphasize with my patients is awareness. Pay attention to how your legs feel before and after. Do they feel lighter, less tight, more stable when you stand up? These small changes are signs that circulation is improving. They're easy to miss if you're not looking for them. In the next part, I'll talk about common mistakes that reduce the effectiveness of this exercise, how long to stick with it, and how to combine it with simple daily habits that support circulation even more. These details are just as important as the movement itself, so make sure you stay with me. Now that you understand the movement, I want to talk about what can quietly hold people back. Over the years, I've seen many men try the right exercise but get poor results simply because of small, common mistakes. The good news is that once you know what to watch for, these are very easy to fix. The first mistake is rushing. Many people lift and lower their heels too quickly, almost like bouncing. When that happens, the calves don't fully engage and the pumping action that helps circulation is reduced. Remember, slow and controlled is what activates the muscle properly. If you can hear your heels tapping the floor, you're probably moving too fast. The second mistake is doing the movement with poor posture. Slouching in a chair or leaning forward while standing shifts the work away from the calves. Try to stay upright and relaxed. Think of your spine as gently stacked, not stiff, not collapsed. This allows the muscles in the lower legs to work efficiently without strain. Another issue I see often is inconsistency. People do the exercise for a few days, forget for a week, then try again. Circulation responds best to regular signals. It's better to do one short session every day than a long session once in a while. I often suggest attaching this exercise to something you already do, like after brushing your teeth, during a television break, or before sitting down to read. Footwear can also make a difference. Very soft or unsupportive shoes can reduce how effectively the calves engage, especially when standing. If possible, try doing the exercise barefoot or in a supportive shoe on a firm surface. This helps you feel the movement more clearly and improves muscle activation. Now let's talk about how long to continue. This isn't a temporary fix. Think of it as daily maintenance, like keeping a machine well oiled. The calves need regular use to keep circulation flowing smoothly. Most of my patients who see lasting improvement make this part of their routine long term. The good news is that it takes very little time and effort once it becomes a habit. Hydration is another overlooked factor. Blood that is too thick doesn't move easily. Many older adults don't drink enough water throughout the day, often without realizing it. You don't need to overdo it, but steady intake matters. A glass of water in the morning, one with meals, and one in the afternoon can support circulation more than people expect. Sitting for long periods is another challenge, especially after retirement when routines change. Even if you do the exercise once a day, long hours of uninterrupted sitting can slow things down again. If possible, stand up every 30 to 60 minutes, even briefly. A few heel lifts while standing can be enough to remind the legs to keep blood moving. Temperature also plays a role. Cold causes blood vessels to tighten, which can worsen circulation symptoms. Keeping your legs warm, especially in cooler weather or air-conditioned rooms, can help. Simple things like socks or light leg coverings make a difference for some people. I also want to mention body awareness again. Improvement doesn't always show up as dramatic change. Sometimes it's subtle. Less stiffness when you get out of a chair, fewer nighttime cramps, a more steady feeling when you walk. These are signs your circulation is responding. Most importantly, listen to your body. Mild muscle fatigue is normal, especially at first. Sharp pain is not. If something doesn't feel right, slow down, reduce repetitions, or take a day off. Progress is not linear, and that's okay. In the next part, I'll talk about the best times of day to do this exercise for maximum benefit, how to pair it with other simple lifestyle habits, and how men over 60 can support leg circulation without overexertion. These final details help turn a good exercise into a powerful daily tool. Now let's focus on timing, because when you do this exercise can matter almost as much as how you do it. Circulation naturally changes throughout the day. After hours of sleep, blood flow in the legs tends to be slower. That's why many people feel stiff or unsteady when they first get up. Doing this movement in the morning helps wake up the calf muscles and gently signal the body to move blood more efficiently before you start your day. You don't need to do it immediately after getting out of bed. In fact, I usually recommend waiting until you've been up for a few minutes. Sit down, take a few calm breaths, and then perform your heel lifts. This can make standing and walking later feel easier and more confident. Another excellent time is late afternoon or early evening. This is when gravity has been working against your circulation all day, especially if you've been sitting a lot. Doing the exercise at this time helps push blood back upward and can reduce that heavy, tired feeling many people notice toward the end of the day. For those who experience leg discomfort at night, doing this movement about an hour before bed can be helpful. It allows circulation to improve without overstimulating the body. Keep the pace slow and relaxed. This is not meant to energize you, but to calm and rebalance the system before rest. Now let's talk about lifestyle support, because exercise works best when the environment around it supports circulation too. One simple habit is changing position often. Even small shifts matter. Straightening the legs, bending the ankles, or standing briefly can prevent blood from pooling. You don't need a formal workout every time. Movement throughout the day adds up. Nutrition also plays a role. Heavy meals can temporarily pull blood toward digestion, leaving the legs feeling more sluggish. Eating balanced meals and avoiding very large portions late in the evening can help circulation stay more stable. This doesn't mean strict rules, just awareness. Another thing I encourage is paying attention to breathing. Slow, steady breathing supports healthy blood flow. Shallow, tense breathing can increase pressure in the body and make circulation less efficient. A few calm breaths before and after your exercise can enhance its effects. Sleep position matters more than people think. Slightly elevating the legs while resting or sleeping can help blood return toward the heart. This doesn't need to be dramatic. A small pillow under the calves can be enough. Comfort always comes first. Stress also affects circulation. When the body is under constant tension, blood vessels tighten. Finding simple ways to relax, whether through quiet time, light stretching, or calm activities, can indirectly improve how your legs feel. Many people are surprised by how much better their circulation feels when their overall stress level decreases. I want to emphasize something important here. None of these habits work well alone. It's the combination that creates lasting change. The exercise activates the muscles. Timing helps it work with your body's natural rhythms. Lifestyle choices support the system so progress can continue. In the final part, I'll bring everything together, explain how to stay motivated without pressure, and share what I tell my patients who want to protect their leg health as they continue to age. This last part is about confidence, consistency, and taking care of your body in a realistic way. As we finish, I want you to understand something clearly. Improving leg circulation after 60 is not about trying to turn back the clock. It's about working with the body you have right now and giving